wish you had a skincare therapist bestie with over a decade of experience whisper skincare tips, ingredients, and solutions in your ear? Welcome to the Skin Coach in Georgia podcast. I am your host, Mayade Samimi, a clinical esthetician and founder of Urban Skincare Clinic. Whether you're challenged with acne, rosacea, dark spots, or just want to learn how to maintain a healthy glow, this podcast is for you. Let's transform your skin one episode at a time. How to remove dark spots. Hello, ladies. Yes, I said ladies because I consider myself an esthetician friend to women. And my goal is to create a safe space for women to ask questions without any expectations. I'm here to share my knowledge as a licensed esthetician, laser practitioner, and certified acne expert, bridging the gap between paid derm appointments and unqualified social media advice, all because I was desperately in need of having an esthetician friend to talk to and to turn to when I was suffering with acne and I had no one. So all that to say, welcome, friend. Today, I'm covering the topic of dark spots, what it is, how they form, and are they removable? Welcome to the Skin Coach in Georgia podcast. I'm your host, Mayade Samimi. Let's dive in. You may have noticed a dark spot or two, or otherwise known as hyperpigmentation, on your own skin, on your face or your body, or on other people. Most people experience dark spots at some point in their lives, which are primarily caused by unprotected exposure to the sun. In general, hyperpigmentation or dark spots are not harmful. They actually form in result of your skin wanting to protect itself from the sun. And most people just don't like the way they look and would want them removed. So, what is hyperpigmentation? Hyperpigmentation is simply your skin producing excess melanin or pigment, which results in small or large patches of discoloration or distinct spots. Let's go over the three types of melanin we have in our body. We have neuromelanin, which is a dark pigment found in the brain. We have pheomelanin, a pink or red hued pigment found in lips, red hair, and reproductive glands. And then finally, we have eumelanin, dark pigment found in hair, nipples, and skin. What causes hyperpigmentation? There are extrinsic and intrinsic factors that lead to hyperpigmentation. Let's review some examples. Extrinsic factors are UV rays, heat, as in sitting in a sauna, pressure, as in picking at your skin or improper extractions, injury or trauma to the skin, as in scrapes, scars, or wounds, and treatments, improper skin preparation or overly aggressive treatments. This one is exactly why I personally would never perform a chemical peel treatment on someone's first visit with me. Now let's move on to intrinsic factors. Those are hormones, as in pregnancy or menopause, hormonal shifts and changes, inflammation, such as acne, genetics or ethnicity, and medications, such as birth control. These are all factors that can trigger or cause hyperpigmentation or spots, darker spots on the skin. Who gets hyperpigmentation? Anyone can develop hyperpigmentation. However, it is more common in people with darker, more olive skin tones. What are the types of hyperpigmentation? There are actually 4 common types of hyperpigmentation. Let's review them. Number 1, PIH. which stands for post-inflammatory hyperpigmentation. These are red or purple pigment caused by inflammation. It's common in acne-prone individuals. Once the acne is healed, it leaves a red or purple-hued spot. Number 2, sunspots, commonly known as age spots, as they appear with age, also called liver spots. Same thing, these are just distinct dark spots on the skin. Number 3, melasma, which is also called pregnancy mask because it's very common in women after pregnancy. It's caused by hormonal changes and shifts, and it looks like a mask, a patch of darkness, not a distinct spot. And number 4, freckles. These are clusters of small red or brown spots on face, neck, chest, hands, and or arms. They're very common in fair skin tones and can be genetics. They get triggered by sun exposure and they can appear on as young as 4 years old. Now that we have a basic understanding of hyperpigmentation, let's talk about how to care for them, lighten or remove them. Number 1 is going to be always sunscreen. Using sunscreen on a daily basis is your number 1 defense against premature aging and preventing sunspots or dark spots caused by sun exposure. UV rays trigger melanin production and are the primary cause of hyperpigmentation. So if you want to prevent hyperpigmentation from developing or keep any dark spots you already have from becoming darker or bigger, SPF is your best bet. And episode number 5 is all about sunscreen, the difference between physical versus chemical sunscreens. Definitely check that episode out. I go in way more detail on the different types of sunscreen and which one is better for you. Episode number 5. I'll make sure to link to that episode in the show notes. All right, moving on. So how are we going to lighten and brighten the complexion and kind of quote unquote remove these spots we have? You want to pay attention to your daily skincare routine as it accounts for 80% of your results. It comes from what you're doing with your skin twice a day on a daily basis. Ingredients such as a stabilized vitamin C, mandelic acid, azelaic acid, retinol, to name a few, are very effective in brightening hyperpigmentation and dark spots. Another important piece to this puzzle is professional treatments. Skincare products are great, yes, and they do make a big difference. However, you can only go so far. Receiving professional treatments in conjunction with what you're doing at home will just take your results to the next level. Now, specifically, chemical peels and laser treatments are going to be the best options to lighten, brighten, and remove any pigmentation. Regular facials are great. Microdermabrasion is great. Dermaplaning is great. But those treatments are not going to directly help with removal of dark patches, dark spots, and evening out the skin tone. And remember, progressive rather than aggressive treatments is always not only the better, but a safer approach. In my opinion, generally speaking, 6 sessions of corrective treatments is the sweet spot, and then you go into maintenance. All right. Now, if you are someone who's looking to brighten, even out your skin tone, and slow down the process of aging along the way, I happen to specialize in this very thing you're looking for. I am a medical esthetician of over 10 years, certified acne expert and laser practitioner, and I encourage people to start with a complimentary consultation, meet with your provider, get their opinion on what you're looking to achieve, look at your options, and you'll be able to decide what's best for you. I actually recommend people to go for a consultation at maybe 2 or 3 different places. Meet with the provider, and your intuition will guide you. You'll be able to make a decision and feel good about it once you've seen, a couple of different places, talk to a couple of different people. You'll be able to choose the best place, provider, person for you. All right, ladies, that is a wrap. Wear your physical sunscreen every day and reapply every 2 hours if you're outside, and I'll catch you on the next episode. Bye for now.